Hi everyone, welcome to Counseling and Virtual Care. My name is Daniel and I'll be taking you through this journey, hopefully interesting journey where you will get to learn lots and lots about counseling. So the idea of this unit is present a bit of another aspect of psychology. So sometimes when we think about psychology, we look at the DSM and the diagnoses and assessments and so on and so forth. And maybe there's a bit of too much emphasis on that. And perhaps we have neglected so far a little bit of the human side of psychology, a little bit of the counseling skills, learning to get in touch with our clients, learning to understand our clients. So that's pretty much what we try to do here in this unit. This unit belongs to the minor within mental health. And this is one of the new ideas that we're trying to develop here at RMIT. So the way we deliver this unit is what we call hybrid mode. So we've got weekly video lectures that I'll be recording and will be available on Canvas for you. And we will also have face-to-face tutorials where you'll get to practice all the activities, all the skills that we will be delivering, and hopefully you get to learn and get your hands on all the skills that we are trying to get you guys to be familiarized with. So the weekly tutorials will have lots of activities, will be delivered by our beautiful tutors. You'll have different options, different locations. Everything is available on Canvas for you to check on the syllabus. So you get familiarized. The idea is for you to get familiarized with where you are located and all of that. If you're not sure, you can always shoot me an email or one of your tutors. All the information will be available on Canvas. But here's the interesting thing. The weekly video lectures will go on for 12 weeks, but the tutorials will only go from week 1 to week 9. So weeks 10, 11 and 12, you will have content available on Canvas, but you won't have to go to campus. Hopefully that's a bit easier for you guys, where maybe at the end of the semester, everyone's worrying about catching up with assignments and so on and so forth. And that is why we designed this unit specifically in that way. We've got 3 assessments, quite fun, quite interactive. That's what I heard so far. So the first assessment is a video where you will be pairing up with a classmate and you will be playing the role of a counselor. So the idea is we'll give you 2 vignettes to choose from, or you can also adjust it a little bit and come up with your own vignette. And the idea is that you will be playing the role of a counselor, a 10-minute video, and your classmate will be the client. In this video, ideally, you will show all your counseling skills, all the counseling skills that you would have picked up by then, because this will be around week 6. The other aspect of this assessment is a reflective piece, just 500 words, so it's quite short, but the idea is to help you identify what you've done right, what you've done wrong, and ultimately the purpose of doing this is to help you start thinking about this reflective practice. So how can I improve? How can I become a better counselor? That's ultimately the goal of this second part of the first assessment. The second assessment involves doing an ethics case study. So I guess going towards the middle of the course, we'll start looking a little bit about ethics. What does ethics look like within the counseling context? We'll be looking at the APS Code of Ethics for doing that. We will have some very juicy, very interesting case studies for you to think about and maybe debate in the tutorials. And the idea is for you to write, identify what are the ethical issues in, again, 2 vignettes that we will be providing. You got 2 options to choose from. Identify what are the ethical issues, identify why these are ethical issues, and what are the ethical courses of action that you could follow using the APS Code of Ethics. It may sound a bit complex, but everything is available on Canvas and the tutors will be able to provide you lots and lots of guidance for you to do the best you can in these assessments. And the third and final assessment, it will be just an online quiz. Of course, it has to be one of those. So towards the latter parts of the course, we'll be looking at counseling approaches. So you will see that we start building from basic counseling skills, so active listening and so on and so forth. And then the idea is to see how these basic counseling skills fit within different counseling approaches. For example, psychoanalysis. I'm sure everyone is super excited about Freud and psychoanalysis. Another approach we bring here is CBT, cognitive behavioral therapy, because that's one of the most used, and perhaps that's something that you will be using in your future careers as psychologists or counselors. But we're also bringing a few different approaches for you to explore, and the quiz will be all around that. Nothing too complex, but we thought it would be great to balance between interactive assessments and maybe something that you could do from home, like the quiz. That's pretty much all the intro I've got for you. Again, in the first week of the tutorials, you will have lots more of explanations, details, the word limits, when things are due, and all of that sometimes creates us a little bit of anxiety as students, and that absolutely makes sense. So hopefully you'll have plenty of time to ask your tutors about all of these. If there's something that is not clear, please do reach out to me. I am more than approachable. I'm always available for you, for all of you. If you've got any questions or anything that is not sitting well with you, that you are uncomfortable, that you are unsure, or any personal issues, please do feel free to reach out. I do answer my emails all the time. And you'll see that sometimes you'll send me an email and I'll reply 5 minutes after. That may not happen over the weekends, but because I'm trying to set some professional boundaries. I'm trying. That's a key word. But yeah, please feel free to reach out. I may not be able to see you face to face, and that's one of the downsides of these modes of learning. But I am looking forward to working with all of you. Hopefully you get lots of fun in this unit, and here we go with the content. In this video, we'll talk about what counseling is, we'll talk about some differences between counseling and psychotherapy, we'll mention about differences between counseling and psychology, and finally, we'll discuss the desired qualities of an effective counselor. Now, here's a word of warning. During this unit, you will be able to develop an understanding of what counseling is and have an idea of the basic counseling skills needed to successfully help your clients. But you will not be a counselor after doing this unit, and neither you should offer counseling services, because you could do more damage than good if you were to do counseling services after finishing this unit. Remember what we learned in the last 2 weeks about ethics? And we said that we always need to have our clients' welfare in mind. And if we are not entirely competent and have fully developed skills or counseling skills, then we shouldn't provide counseling services until reaching that point. Now, I have to say, I am confident that you will reach that point in your professional career where you will be able to provide counseling services because you would have fully developed your counseling skills. However, keep in mind once more that you will not be able to offer counseling services after finishing this course. Alright, having said that in terms of providing counseling services after this unit, let's start by defining what counseling is. Counseling is when one person, and that could be a therapist, counselor, psychologist, psychiatrist, or social worker, intentionally attempts to facilitate personal growth in another person, and that would be the client. And this is done through the provision of a consensual professional relationship. This counseling relationship involves interventions informed by psychological theory. We can also mention the different modalities of counseling, and this could be something like individual sessions, group sessions, couples therapy, or family therapy. Now, the main difference between these types of sessions is the possibility of exploring the dynamics of how people relate to one another. So for example, in one-on-one sessions, the client can only interact with the counselor, and if the client is feeling frustrated or is angry, it could be that those feelings are projected from the client towards the counselor. But in different settings like couples therapy or group therapy, clients could interact with one another, allowing the nature of their interaction to be observed by the counselor and be discussed. And this could be reflected upon and hopefully improved. Here is an interesting picture I saw once in a lecture, and I decided to use it because I thought it was funny. I like this picture because it reflects the different expectations people have when they think about counseling. So, for example, maybe society and friends think a counselor doesn't do much during sessions. But the reality is that depending on the topics discussed, a counseling session can be quite demanding for the counselor because it requires constant and undivided attention. And this type of attention will likely not be required from us when we're doing other type of tasks. In fact, this attention I mentioned is called active listening. Now, in the coming weeks and in the coming videos, we'll talk more about this concept because it's one that can make or break the counseling process. I also think it's funny the picture of what my clients think I do, because there is really no magic wand and there are no magic tricks. We can't fix people because people are not really broken. We can only work with our clients to guide them through the therapeutic journey. But this journey must be done together, counselor and client. Because if the client is not interested in changing or addressing something, change and improvement is very unlikely to happen. I usually see this idea of the fairy godmother magically fixing our problems in my clinical work with kids. Parents will normally come and say, "Hey, here's my kid, fix it for me." As if they didn't have much to do with whatever is happening for the child. But as you can suspect, there is usually a connection between the parents' actions and the problem affecting the child. And it's not uncommon to see parents taking a passive approach rather than owning their own issues. Again, this idea of magically fixing something rather than doing the work. I love the picture of what I think I do. That person in that picture is Sigmund Freud, an Austrian psychiatrist who came up with the concept of topography of the mind. You may have also heard of the idea of conscious and unconscious, or the id, ego and superego. So Freud was a very controversial figure, but despite a lot of people trying to take credit away from Freud and his concepts, we should acknowledge that he was one of the biggest iconic persons within counseling, and his concepts were quite groundbreaking. So the idea of this picture is what I think I do, again thinking, well, I may be as good as Freud, but the idea is that we're probably not. We will want to be a bit more humble than that and cherish the little differences that we can make in our client's life, rather than thinking I need to solve everything for my client and I need to absolutely be the best psychologist or counselor this client will ever have in their lives. And so, talking about Freud, here is a question for you. Are counseling and psychotherapy different? Because we said that counseling involves a professional relationship between a client and a counselor, where there is an intent of facilitating personal growth informed by psychological theory. But is that any different from psychotherapy? Both of these concepts are defined quite similarly, but to answer this question, we need to provide a bit of historical context. I like to think that the idea of psychotherapy comes from the Freudian school of thought. Some scholars attribute the creation of psychotherapy to Franz Mesmer in the 18th century, who included hypnotism in his practice. And funnily enough, that's where the word mesmerized came from. Then, in the mid-19th century, Jean-Martin Charcot, a French neurologist, became interested in the idea of hypnosis and started working on hysteria, which was a word used at that time to describe difficulties with regulation of emotions. One of Charcot's students, Sigmund Freud, became interested in the ailments of the mind and did a lot of work on client observation. And he came up with certain patterns and situations that would be repeated across clients, leading him to think that if he addressed those patterns, he could help his clients overcome those mental ailments. And that's how the idea of psychotherapy or psychoanalysis was formed. Now, here's an important element. Freud believed that personal issues stem from early childhood experiences, and necessarily the analysis of the mind would need to explore those early childhood memories. And as you can imagine, that process would take a very long time. But it would also allow this idea of psychoanalysis to deal with long-standing and severe psychological issues. But as society evolved and things became more dynamic, scholars started to challenge the principles applied to psychoanalysis. For example, in the 1920s, scholars such as Volpe or Skinner would dispute the existence of the unconscious because it couldn't really be demonstrated. Now, I'm aware that we haven't defined what the unconscious is, and this is quite a complex concept that will probably take a bit of time to define appropriately, but basically, a very condensed definition is the idea of all these repressed desires, wishes, and what we perceived as inappropriate thoughts being pushed out of our conscious awareness. And so these new scholars propose the idea of behaviorism, which pretty much deny the existence of the unconscious, or at the very least challenge the idea of the unconscious. And they propose that if we can learn to respond to situations based on our experiences, then they said, well, if we can learn to respond, then we can unlearn to respond to something. And that is why we now talk about this idea of classical conditioning, operant conditioning, role modeling, social learning, and other behavioral concepts. And I should mention that the dog we see here is in reference to Pavlov. You might have heard of him and his salivating dogs to demonstrate the idea of classical conditioning. Now then, in the 1950s, the cognitive approach came about, where they proposed that how we think about things, or in other words, our cognitive processes, affect our mental well-being. And that is why we now talk about cognitive behavioral therapy, or CBT. Also, in the 1950s, the existential and humanistic perspective became more prominent, or became more, part of the center stage. And these ideas propose a paradigm shift, moving away from the idea of the expert identifying the problems for the client, and here the expert will be the counselor or the therapist, and they propose an emphasis on a person-centered approach, where the client would be seen as the expert in their own issues. And that is why we now sometimes move away from the importance of techniques in therapy and pay more attention to the therapeutic relationship, and the counselor is being seen as a human being rather than an expert. So now that we've covered a little bit of a historical context, we can go back to the question we posed a few slides before, thinking, are counseling and psychotherapy the same? So to answer this question, we could say that some people may see these as synonyms, but the reality is that counseling is focused on more minor life adjustments or minor challenges, whereas psychotherapy addresses long-standing and severe psychological difficulties. Again, counseling may be more aligned with what is happening for us right now and look at how we can address these problems to improve our future, whereas psychotherapy may involve delving into our past to try to identify the roots of our problems we are experiencing right now. Counseling focused on helping people become more effective problem solvers, whereas psychotherapy traditionally focused on developing deeper insight into the unconscious meaning and origin of psychological difficulties. So for example, one counseling approach is called solution-focused therapy. And one of the premises is that it is short and right to the point. When using this approach, we deliberately focus on the client's strengths rather than weaknesses. And we do this to help clients use their skills to solve problems rather than focusing on the things they can't do. And we already mentioned that counseling was traditionally short-term and psychotherapy is more long-term, because trying to address entrenched issues will naturally take longer time. Now, keep in mind that this is a very brief history of counseling and psychotherapy. But the thing is, in this unit, we don't want to delve too much into the history side of counseling. Many of these concepts are quite important and complex, and we will discuss some of these concepts in the coming weeks, but some others will not be included in this unit, and you may want to expand on this in your own time. Now, having said that, here is an important idea to consider. In the past, counselors were more focused on adapting a specific school of thought within psychology and specialized in that particular approach. For example, someone may become an expert in a Gestalt approach and try to implement these principles with most of their clients. But nowadays, scholars talk about an eclectic approach to counseling. And in this context, eclectic means using many different techniques and approaches to address different client presentations. For example, Lambert discusses that a big part of the effectiveness of therapy comes from the therapeutic alliance and extra-therapeutic factors, and the theoretical models and techniques used in counseling only account for 15% of the therapeutic effectiveness. In this case, extra-therapeutic factors would be things like client predisposition to therapy and their willingness to put in the work. And the therapeutic alliance refers to how well the counselor connects with the client. And that is where there is an emergence of postmodernist approaches to counseling, where the therapist doesn't fully embrace one perspective, but adopts a more eclectic approach, including a range of different approaches, different techniques and perspectives. So in this sense, a counselor should look to become more well-versed in different schools of psychological thought. So to sum up this idea of a postmodernist and eclectic approach is, once more, not fully embracing one perspective and saying, well, I'm going to be a psychoanalytical counselor or a psychotherapist, because then you may be focusing too narrowly on how to approach things. And because there are so many different schools of thoughts and so many different perspectives, nowadays it's recommended to become well-rounded and learn a bit more about all these different schools of thoughts. And then we may have an inclination to, for example, be more psychoanalytically oriented or more CBT oriented, and that's fine. But at least having these really big bag of tools and being able to pull out a different tool for a different presentation. Alright, so now let's move on to the next idea. Let's look at counselors and psychologists. And we can ask ourselves, are these two roles the same? Well, the reality is that a psychologist has a broader range of action than a counselor. We could think of counseling as sitting within a psychologist's skill set, but a counsellor in Australia may not be able to do all the things that a psychologist does. For example, in week 1, we said that a psychologist can work in a variety of roles, including assessment and therapy, organizational and social change, psychological testing, in school context, or in research. Well, a counsellor can do some of those things, but not all. The main limitation of being a counselor and not a psychologist is that a psychologist can conduct psychological assessments and a counselor cannot. And even if a counselor does the same training and learns how to conduct psychological assessments, they won't be able to write a psychological report or diagnose someone. As an example, let's think of the Wechsler Intelligence Scale, or WISC. This is an intelligence test to assess cognitive function in children aged between 6 and 16 years old. Only a psychologist can access the test kit and produce a psychological report once they applied this test. However, both counselor and psychologists would be able to conduct counseling sessions and be involved in psychological therapy. We should also mention that a psychiatrist could provide counseling sessions, and they actually do provide counseling sessions, but that involves, or becoming a psychiatrist involves studying medicine and then becoming specialized in problems affecting the brain, such as schizophrenia or bipolar disorder. In fact, a counselor or a psychologist seeing a patient with, for example, manic symptoms may refer them to a psychiatrist to access the right medication in addition to seeing a counselor. So far we talked about the difference between psychology and counseling. We talked about the difference between a psychologist and a counselor. Now let's focus on the counselor as a therapeutic person. So who is a counselor? What does a counselor look like? And which values and characteristics would be desired in a counselor? Well, the most important instrument you have to work as a counselor is, of course, yourself as a person. This sounds a bit silly, but counseling comes down to that: human connection, quality human connection. One person, the counselor, being able to be there for the client, being able to give their undivided attention and foster that human connection that the client is probably seeking. And the other person, the client, who's willing to be honest, to open up and talk about their issues, as long as they have the counselor there to back them up, to feel that there is that human connection. That is why we emphasize a lot on this idea of the human connection. And in this way, the counselor becomes inextricably entwined with the outcome of therapeutic process. The counselor becomes part and parcel of the process. So again, it's not so much about the techniques, it's way more about the counselor as a person. And this is important because if we hide behind the safety of a professional facade, the clients will likely keep themselves hidden too. So it's good to show our humanity, our vulnerability, and our compassionate side to make the client feel welcome, heard, respected, and understood. If we manage to do this, we are already halfway there, and we will likely make lots of progress with our clients. So once more, what we're proposing here is an emphasis on the human connection. That is not to say that the techniques are important, and in fact you will see that different counselors or psychotherapies will have a slightly different perspective. And that comes with what we were saying before in terms of being eclectic, being able to incorporate different approaches, and perhaps you may come across different lecturers or different scholars later on in your professional development where they are very much adhering to specific techniques, and that's okay. As long as you know that there are different approaches to counseling where some of those approaches, like the one we're proposing here, emphasizes the importance of the counselor being able to connect with the client. And once more, this connection must come from an authentic and genuine space. Because if we are inauthentic, we will have a hard time developing a therapeutic relationship with our clients. Now, to illustrate this idea, here we have a nice quote extracted from a 2007 paper titled "The Medical Model in Psychotherapy, Its Limitations and Failures." This paper was written by David Elkins, and we will put a link on Canvas for you to access the paper and see what we are trying to represent here. The quote says, "It's not the theories and techniques that heal the suffering client, but the human dimension of therapy and the meetings that occur between therapist and client as they work together." Basically, in this paper, Elkins provides a critique to the medical model, saying that the mental ailments are not just symptoms that need to be cured, and counseling should be the vehicle to create a human connection through which the client and the therapist can connect and explore the client's issues. So once more, this quote is relevant because it moves away from this idea of mechanistic prescriptions and perhaps somewhat rigid techniques, and it highlights the personal characteristics and how the effective relationship between counselor and client can be quite therapeutic. Alright, so let's go back to the characteristics of the counselor. We can say that the counselor has an established and consolidated identity. Ideally, an effective counselor would have spent time reflecting on their own issues, trying to understand their own shortcomings. And this would lead them to respect and appreciate themselves. And this idea of self-respect is really important because there may be occasions where the clients may project their aggression to us, or we may feel rejected by clients. And if we are not comfortable on our own skin, receiving that rejection or aggression can be quite challenging. The counselor would also be open to change because they're not afraid to be outside of their comfort zone. An effective counselor would make choices that are life-oriented, looking to be healthy, to enjoy life, and to be safe. They would also be authentic, sincere, and honest because they're not trying to be someone they're not. And that comes with reflection and introspection to address our own issues. they will have a sense of humor, but fundamentally being able to laugh at one's own error. In fact, in 1970s, a psychiatrist named George Vaillant expanded Anna Freud's work on ego defense mechanisms and identified humor as a mature mechanism found in emotionally healthy adults. An effective counselor makes mistakes and willingly admits to them, appreciates the influence of culture, has a genuine interest in the welfare of others, possesses effective interpersonal skills, and is able to maintain healthy boundaries. Now, we just mentioned that an effective counselor would have spent time aiming to address their own issues and shortcomings, and that process will likely enhance the importance given to their own values and convictions. And while the counselors would be ideally understanding and respectful, they are not entirely objective or value neutral. I mean, we're all human beings and we will all have formed opinions. And it may well happen that you don't agree with all of your clients or all of your clients' values, beliefs, and life choices. But you need to respect the right to hold different values from your own. In other words, you would need to bracket your assumptions and convictions so they don't contaminate the counseling process. Bracketing in this context means pausing your own judgments and convictions and putting them aside to allow the client to explore their own values and convictions. And that is exactly why we say we're not advisors. In fact, we should generally refrain from providing advice, and it's usually not beneficial to do so. Nor is it helpful to give clients your answers to their questions about life. Because while it may seem like clients come to us with questions hoping we will answer the questions for them, they will benefit much more if we provide the space for them to answer these questions in their own time according to their own values. In fact, providing advice would be akin to value imposition, and this would result in imposing our own values, attempting to influence a client's values, attitudes, beliefs, and behaviors. And as we saw last week, this would be unethical because we would be limiting their autonomy. And with that, we conclude this video. Be sure to check the links and relevant information on the tutorial section of Canvas to expand your knowledge on these topics. I hope you find this content useful, and we will see you in the next video.